The greatest way I can connect with that purpose is popping in a patient's room when I'm at one of our hospitals and finding out about them, exploring what brought them to the hospital, how is their care, what are they most worried about, what could we have done differently or better to deliver exceptional care. I want to learn from them. Whenever I'm feeling a little blue or down or frustrated with this, that is the best way to help center us.
Hello and welcome. I'm Chris Malone, and I'll be your host for today's discussion. Thank you for joining us. Once again, I'd like to welcome our friend, colleague, and program partner, Michael Giuliano. Michael is president of Planetree, which is a global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. Welcome, Michael. What can you tell us about our guest today?
Thank you, Chris, and welcome everyone to this May episode of Humanizing Healthcare. It's great to have you with us once again. It is our pleasure today to speak with Amy Searls, the Chief Experience Officer with Prime Healthcare and a leader in humanizing healthcare for all. In her role, Amy oversees the patient journey and provider experience for Prime Healthcare's 44 hospitals and over 300 outpatient locations across the country, so quite an extensive network. Prior to her role at Prime Healthcare, Amy worked at UC Health for 8 years as the Executive Director of the Office of Patient Experience. She has also had leadership roles focused on service excellence at Providence Hospitals and Banner Health. Amy has been recognized by Becker's Hospital Review as one of the Chief Experience Officers to Know in the United States for multiple years, most recently in 2024, and has been recognized among the top 50 women leaders of Los Angeles for 2022. She's also a winner of the PRC Healthcare Leadership Award from the Healthcare Experience Foundation and appears as a speaker with the National Gathering for Patient Experience, or NGPX. So welcome, Amy, to this podcast. We're really looking forward to the discussion today, and thank you again for your time.
Thanks, Michael. Thanks, Chris. Really excited to be here today.
Thanks very much, Michael, and welcome, Amy. So to get us started, Amy, I'm wondering, is there a story or experience you could share about how you found your way into healthcare? Was there anything in particular that drew you to that career that you're in now?
Thanks, Chris, because I was thinking about two different paths that kind of led me here. And I'm going to go back to the first path because it was a very long time ago. And I just recently almost kind of came full circle. I got to go back to the hospital I started at as a candy striper. It was south of Chicago in Kankakee, Illinois. And I was able to walk the halls there and get inspired. And I actually remembered the first room I ever sat with a patient who was actively dying. And I remember the nurses were so busy, and here I am, a young candy striper, probably 14 or 15 years old. And they asked if I could sit and just be with that patient and read to that patient. And I remember being in the room and holding that patient's hand and reading a book to that patient when they took their last breath, and how powerful that was, and what an honor that was to be there and be witness to that. So that was probably the earliest path. Many other paths led me to on this path of where I am now, but that was one I just recently got to revisit, and it sticks in my mind and heart.
Well, that's really touching, and it's really such a testament to someone at their age of 14 or 15, spending time in a hospital, offering care and comfort to others at the end of their life. It's really a great way to start our conversation. So with that as the beginning, what can you tell us about your current role as Chief Experience Officer at Prime? What kind of things does that entail, and what are some of your priorities for the coming year?
Yeah, so I was listening to when Michael did the introduction. We are now at 51 hospitals. So we are in the process of huge growth right now. We had a historic acquisition this year where we actually acquired 8 hospitals in Illinois. And then we are looking at some additional hospitals in Maine. So this is a really busy time for us in Prime. There's a lot of growth. In my role now, I have a small team, lean corporate team, and that's part of our model. But we really empower the people, boots on the ground in the facilities, to really help us drive this important work. And it is important work, right? We want to make a difference in people's lives.
And what are some of the challenges or priorities you have focused on? Is it aligning the patient experience operations of these disparate organizations, or how do you go about with that such growth and such size managing?
I'll take the first part of the question, because I do think what are some of the challenges? The challenges in this model is we go in and we rescue hospitals that are in financial duress, right? So there's problems associated with that. It might be equipment that are, it might be culture that's been beaten down. It might be the unknown that staff are feeling. Here you have another acquisition, and who's this owner and what are they going to do here? So a lot of that plays into culture. And so a lot of the challenges we face when we do go in and rescue hospitals is that they don't know us, and we are trying to put our best foot forward and help them kind of right the ship, because these hospitals are struggling financially. And to keep the doors open, there's some tough decisions that have to be made. And often those decisions become personal for the folks who are the boots on the ground, and they wonder, well, why, is there some office in California that's making these decisions and they don't care about the people? We do care about the people. We care deeply about the people and our patients. And that makes it a little difficult because they don't know us and we want to go in and help them. But you can't help them. You can't do the same thing and expect a different result, right? Otherwise, they wouldn't have had that hospital up for sale. So we have to go in, and oftentimes we're seen a little bit as the bad guys. So those are some of the challenges with these acquisitions and the model. And then the other part of the question is, how do you do this work, looking
Yeah.
at it? And I think that's also a challenge, because we don't have this big, robust patient experience team that goes in and does culture work or training or OD work or this or that. We run so lean because of the model. Again, we're trying to right the ship. And so our goal is to look for kind of, I think about Mr. Rogers' quote about find the helpers, like when things are dark, find. And that's what we do. We look for the people that can be our champions, our patient experience, our experienced champions, our helpers, the boots on the ground. Sometimes these are people that just have that desire. They stick out among the team because they care deeply about the work related to patient experience or physician or provider staff experience. And so we tap into those people, and, rather than say, we're going to add one more thing to your plate, we want them to blossom. So maybe it's a stretch goal for some of these people in their careers.
Sure, sure. Now, one of the underlying premises of our program is that as healthcare organizations have become larger and more digital and sometimes focused on cost management, care experiences can sometimes feel more kind of transactional or impersonal or disengaged.
Absolutely.
Now, as one of the largest healthcare providers in the country, how do you maintain a focus on delivering relational experiences as you grow larger? Is that something that you're focused on as well?
Definitely. I am a huge fan of Jean Watson, nursing theorist. I don't know if you know of her
I
work. I
am.
suspect you do. But her whole model, when I think about it, she said something once. When I was working in Denver, I had a great opportunity to learn from nurses who work directly with her and from Jean. And I remember her saying, what leads to burnout and fatigue in healthcare is that we're not entering into the relationship with our patients. That's why we go into healthcare. We want to make a positive difference for people who are hurting. And we're not wanting to work with widgets, right? We go with humans, right? And it's in that connection, that human connection, that our milk buckets get filled and we feel better about the work. And so that is what drives me. That is how we look at healthcare and how we deliver this work. I use a lot of Jean's work in my head, things I've looked at and said, okay, we're going to develop a communication model. And part of our communication model is the relationship piece. We don't use AIDIT. Many organizations use AIDIT, and that's a Studer thing, and I get it. And that was actually intended for service organizations that healthcare adopted. We use more of a model that really focuses heavily our communication model on the relationship. And so we teach that new employee orientation. We also train all of our leaders in this model and then continuously give small doses of education throughout the year on the importance of developing the relationship and health literacy and how that plays into all of this. And that human connection is key. So we really strive to not just do a one and done training, like, woohoo, you did your health stream training, you're done. We have to make it more personal and make it come alive. Part of the model that we use is really, it's been built so that it can be delivered in 4 quadrants or 4 modes. One is the staff meeting, for a nurse leader or a staff or department leader we help them, we build the curriculum, we give them all the tools, we partner with them. But when you ask, how do you do this work and being so lean, we empower that frontline leader to actually own a lot of this. So the first mode is staff meeting. The second mode is short shift huddles. The third mode is when you're rounding on a staff member one-on-one. And then the fourth mode is email communication. So many, whether you're printing something and putting it up on a staff communication board or you're emailing a certain staff person. So those four modes we know are ways that we can impact our staff. And then we help empower that frontline middle manager leader to actually lead this work, which we know is a best practice. They're the one who has the biggest impact on culture. So we know if we can grab their heart and mind and give them the tools and resources without making them feel like, oh my gosh, you're giving me one more thing to do. We want to make sure it's easy, seamless, good for them to do so that they can own it, make it their own, but have the bones behind it. Make sense?
Absolutely. And I'm so glad to hear you talk about relationships. That is something we're hearing more and more, this growing belief that healthcare needs to be about building those relationships between patients and clinicians. And in fact, Prime Healthcare is one of the founding members of our patient-provider relationships and outcomes collaborative with Mayo Clinic. I was wondering if that's part of what drew you into that or what you found from that group so far.
Absolutely. And I got to tell you, when we were first, approached about this, I felt like that middle manager leader were like, oh no, one more thing to be in and one more thing. But I got to tell you, the thing that keeps us there and really helps fill our milk buckets is being with like-minded leaders out there who are doing this work, who are passionate about this work, who want to make a positive difference and who want to grow and be better. So absolutely.
Now, you also mentioned that you are responsible for both patient experience and staff experience. How do you prioritize those two twin commitments, if you will? You mentioned,
Yeah.
some of the challenges. Is that one of them?
Yeah, so this kind of happened organically during COVID, really, and post-COVID, where we saw real burnout and fatigue among staff, and real grief among a lot of staff, right? And how do you handle that? So our team, again, our model is very lean, but we took our regional directors, our regional patient experience leaders. We have about 5 throughout the country, and we pulled them together and we said, what can we do to help with mental health and awareness? What can we do for employee engagement, employee experience? What are some of the things that matter and who's doing it well? That's the beauty in having so many hospitals. We can say, hey, if you look over at St. Francis in Linwood, California, they're doing amazing things. Let's find out and learn from them and then cross-pollinate across the whole system. So that's been one of the gifts of being with such a large organization. We're able to tap into creativity and talent at our local facilities and learn and grow from them, and then take that and spread it across our other facilities and help them be better. And that happened post-COVID, really, for a staff experience. Some of the things we're working on related to that is mental health and wellness. We developed, everybody says an app, right? You got an app for that, right? You kind of joke about it. But that was something that we saw during COVID when people weren't able to go out. How are you connecting with others? So everything from yoga or art museums or listening to music to soothe the soul, or maybe it's meditation. We have a chaplain at one of our facilities who actually, we taped him like doing some morning meditations and added that to the app. And we have found so much real positivity from staff, really appreciating that we did that. But then at the local facilities, part of the Prime model is not to have this big corporate office directing everything. We really know when you've been to one Prime hospital, you've been to one Prime hospital. We don't want to be cookie cutter. Some big systems do want to be like that, but we want the local facility to have their own culture, their own flair, their own message. And then we can help uplift and guide with resources.
It's one of the challenges that comes up, right? When you're such a
Yeah.
large organization, is
Yeah.
it one flavor for all, or
Yeah,
do they all
right.
retain their own identity? You've often spoken in the past about connecting healthcare providers and staff with their deeper purpose. I'm wondering if you could tell me more about why that is important and how you go about doing that.
So selfishly, I mean, that's something that I need to keep my milk bucket filled, is to connect to purpose. It's why I went into this work. It's why this work has such meaning for me. And the greatest way I can connect with that purpose, Chris, is popping in a patient's room when I'm at one of our hospitals and finding out about them, exploring, what brought them to the hospital, how is their care, what are they most worried about, What could we have done differently or better to deliver exceptional care? I want to learn from them, but that's whenever I'm feeling a little blue or down or frustrated with this, that is the best way to help center us. And so I know what that does for me, and asking other clinicians and caregivers, how do you do that? And overwhelmingly, if we pause and take time and help, connect to our purpose, generally 90% of the time, folks will tell me it's from their patients. It's from hearing from our patients and not feeling rushed. It's from taking those few minutes at the bedside, pointing your heart towards the patient, looking at the patient in the eyes, and making that human connection. And then you get that bounce in your step to go back and be energized and feel like this. And that's something with new grads right now, Chris. I feel like they are so worried that, we push them so fast out on the floor. We want to get them out there. We need them. But that human piece is something that I think they're often missing because they're so worried. Am I going to make a mistake? Am I doing everything correctly? Have I checked all the boxes before I go home at the end of my shift? So kind of getting into their heads and hearts and finding out what makes their heart connect to purpose and what will help them be better nurses or caregivers. And overwhelmingly, it's the pace, right? They're feeling like so pushed and rushed. So if we can give them pause to say once during your shift, just take one time during your shift where you pull up that chair at least one time and point your heart towards that patient and find out something. Is it that they're a cat lover, or do they like your favorite sports team, or do they plant a garden? Those things, I think, are so meaningful. When I was in Colorado, I had an OR department. I had a nurse who was credentialing for a level 3 charge nurse, and she was working on a project. And one of her projects was actually humanizing the patient experience. And she added to everyone's badge, at the bottom of their badge, something that might have said, I'm a Broncos fan, or I'm a gardener, or ask me about my dog. And this was meant for patients where they get just a few minutes with them as they go before they go under for the procedure. And they wanted to put patients at ease. And what they found was it actually had more benefit for the staff, or just as much benefit for the staff as it did for our patients, to have that human connection, right? So that's that purpose that I feel is so important for us all to take time, at least, whatever it is during your day or week, to make that human connection with those we serve, right?
Well, you really mentioned a number of meaningful things there. One, that many, if not most, healthcare providers came to healthcare to have relationships with patients and to feel that distinction. But also, as you mentioned, with younger ones, they're probably so concerned about what we kind of call the competence side of the equation, wanting to be able to do the tasks and the clinical things right. But you make a very good point that not only does that warmth make a good connection with the patient and let them feel safe and cared about, but it's equally valuable for the care provider. It's the fuel that keeps them going and connects them back to that purpose. So I think you really described it really beautifully. Now, that being the case, we're surrounded by technology, right?
Oh, gosh,
all kinds of new technologies coming to the fore, particularly in healthcare. From your perspective, where do you see health technology being an enabler of more of that? Or where do you see perhaps risks for it to be a disruptor of some of that connection to purpose?
Yeah. So we are in the process of beta testing a big piece of technology right now with a partner of ours, Steer Health. And I am a huge fan of it because personally, this is what it can do. Okay, everybody's tied to your phones, right? Even me, we're all looking at our phones constantly. New grads, especially, right? Let's look at that, And so, how do we make it easier for patients, new grad staff, so we're not giving them more to do and making it simpler? So, part of the solution that we're beta testing right now is, rather than put your call light on and wait for your nurse and the nurse or somebody on the other end of the intercom, how can I help you, Amy? Yeah, I see your call light's on. This would be an easy text to a nurse that would say, hey, I'm wondering, when am I going to go home? I know you're really busy right now, but do you be able to text? But it would have these pre-populated things. Is it food? Is it service? Is it pain? Is it this? Is it that? And do you need a warm blanket? Is it about discharge? So that it does make the nurse's life simpler on the back end, so that the nurse goes, oh, it's just Amy needs ice. That's it. Is somebody close to that room can grab them ice really quick? Or is it something bigger, like a discharge question that I'm going to have to go into their file, get a little bit more information before I answer? So I am a big fan of this, and it stemmed from when I had some knee surgery a couple of years ago. I was in one of our hospitals, prime hospitals, and they were slammed, of course. I'm like, no, picked a bad day to do this. And my daughter was like, Mom, I thought you were going to go home now. Why is it after you told me it was going to be about 2? Should we call someone? I'm like, Abby, they're busy. Let's not call them. And actually, that text thing would have been amazing for me to say, in Amy's voice, I know you're really slammed right now, but wondering if you had an ETA on when I could go. That would have been, and so that's what we're working on right now, is beta testing something like that, so that it is an easy mechanism for folks who use their phone, but also for the back end user, to our nurses and staff, to say, oh gosh, that's what they need. It's going to make my life simpler. What we've found so far, now this is pretty early data, is that if this is used well into its full capacity, it does decrease the number of steps for nurses, which we know nurses are getting a lot of steps in throughout the day. So if that can be a win for them, where they actually feel like it isn't one more thing for them to do, but it will make their life simpler, that's a win from that end. The patient's win is, oh my gosh, I may be able to communicate in a way that I like, versus put on the call light, talk to somebody. People aren't into that talking thing as much as before, right? Especially in short little snippets that we can just say, I need ice, I need a warm blanket, I need my pain shot. Right?
Yeah, and I suppose in that regard, it's more similar to the kind of communication we're doing outside the hospital, right?
Yes.
And it's
Yes.
making it more efficient and more familiar and easier for everyone. What are some other things that you have seen that you're excited about from a patient experience standpoint? Any new developments or trends or things that you've seen or heard of that have you interested for the future as well?
I'm also one of the things, I don't know if it's a newer thing, but my chart. I'm a big fan of my chart for patients, but I don't think it's being used to, with its full capabilities. And I think if we could help patients and providers both with my chart, I think people are just nervous. Some folks were in some of our markets, Chris, my chart's easy breezy. In fact, in our Illinois market right now, and you know what made it easy was physicians were the ones pushing my chart, not the staff. It wasn't the admitting folks signing people up for my chart. It was the physicians saying, hey, if you want to get a message to me, or you have questions about your medication or this, use this, and I'll get back to you right away. So I would really like to see that used more, to its full capability. But the other piece I'm a little bit looking at is the whole Amazon thing, like healthcare, and is there simplicity, and can we learn? Amazon's done a lot very well. I'm a frequent Amazon shopper, but I can go on and look at past orders. I can look at, what have I paid? I can look at the ways I'm paying, multiple different vendors. So I'm thinking if we can learn more and be more agile. Healthcare's always been so clunky. Even if it's you want a copy of your bill or what's the insurance paying, and that it's not as easy as something that I think as it can be or it could be, right? So down the road, I really hope that we break down some of these barriers and can make it easier for our patients and families to schedule an appointment, to get that appointment, to understand what's happening during that appointment, to pay for that appointment, and then any follow-up right afterwards, that whole continuum. I had a friend who recently had to go for a colonoscopy, and he called me up and he said, Amy, I'm struggling getting into a center. Can you help me? I've been calling and I need to find something kind of quick. And I was like, oh my gosh. And so then I just kind of started calling here at my office saying, who should he, and like right away, he was able to get in, but he needed somebody from the inside to help him. And I don't want that for people. I want it to be easier, seamless, right?
Yeah, you won't want it to be one of the more difficult things that we struggle with every day relative to
Yeah,
all the other things that we
right.
either commit to, purchase to, schedule, or visit.
Yeah.
Now, you work actively with young and emerging leaders, and you have had a very, successful, accomplished career. What advice would you offer to someone who is perhaps younger in their career that aspires to become a chief experience officer in a healthcare organization? What advice or guidance would you have for them?
Yeah, I love that you asked me that, because that's one of my passions, is really helping leaders grow and learn. And what I would say, and this is kind of a hard thing to tell people, is get involved in operations. Some people want that easy path, like all the way up to patient experience. And oftentimes they think it's an easy breezy job. Telling you, it's not as easy as it looks sometimes. But what I would say has helped me the most was being involved in operations earlier on in my career. I was given stretch goals. One time I ran a radiology oncology department while someone was on leave. And I thought, well, I had really no experience with that. But what a great opportunity that was to work with physicians, to work with staff, to work with patients, to work with scheduling, to work with all the different modalities and it was only a short period of time, but it was still enough to kind of give me, okay. Another point in time, I was given the security department and nutrition services to oversee, and people would think, well, how did that helped an awful lot getting into this role. And then partnering so closely with the clinical teams to understand really what happens on the units on the floors, because I think so often it's easy for somebody to think, well, if they would just do this, their scores would be better and our age gaps would be. It's so much more complicated, and it's human beings, it's processes, it's systems that are clunky, and you have to marry all three of those together in a beautiful way to create that great patient experience. So unless they can get in and understand what the clunkiness is and what the heaviness is of some of the staff who go home some evening, that heaviness, that burden that they're feeling, I don't think they'll really understand what it takes to kind of keep moving and driving this work.
Yeah, I think that makes a lot of sense. And what we've observed as well, a lot of what you've described is that, chief experience officers, there are some things they have direct purview over, but
Yeah.
most things they are
Right.
an ambassador, a
Yes.
facilitator, an influencer, a communicator, a coordinator, an inspirer, and all of those things. And many of those that I have had the opportunity to meet and talk with are just incredibly articulate as
Yeah.
well. And so it sounds like those are all things that you've seen as well.
Yes, definitely, definitely. And one of the things that unfortunately has hung a few people up is not having that executive presence and not being that subject matter expert, right? To get immersed in everything patient experience, to learn as much as you can on the path of what happened 10, 15 years ago to what's happening now with technology and forward thinking solutions, but also being able to present yourself in a way that you are that subject matter expert. You are able to be comfortable at a seat at the table with the executives.
Yeah. Yeah. So now let's take a few questions from those listening remotely. We do have anonymous question. What is your version of aided? He said, I missed it. Do you
Oh,
want to just talk about aided a little bit further?
yeah. So yeah, again, we don't use aided, we use great. Great is similar, the greeting, but we talk about in the first initial the greet is, the 5-10 rule of, all of that. But how do you make an impact right off the get-go to set the tone with your patient? The relationship piece, to take a seat, to point your heart towards the person, to find out something maybe that they're very fearful about, or something to connect with them at the personal level. The education, we talk a lot about working out loud or narrating our work. The ask, we use teach back. And then finally, we thank people, but we don't want to sound like we work at Walmart or, thank you for choosing St. Mary's for your healthcare needs. We want people to use their own voice, but to say it was really an honor to take care of you. I'm going to be thinking about you over the next couple days when I'm off and hoping you continue to heal. Those kind of things. Yeah. But
Very
that's great
nice.
in a nutshell. Yeah.
Yeah. GREAT. Terrific.
Yeah.
Now, we also have a question from Jake Poor. Do you have a purpose statement that unites all employees, students, clinicians, and volunteers across hospitals, or is that perhaps something that happens more at the local level?
It's more at the local level. Prime does have, I would say a mission and vision statement, and we are here to save hospitals, to save jobs, and to save lives. But then we empower that local team to come up with a bigger statement of who they are and who they aspire to be.
And that allows them to make it their own and feel
Absolutely.
that ownership of it.
Yeah.
Very nice. We've got a question from Mariz Shah. He says, I'd like to ask Amy her experience in strategies for engaging frontline care providers in relationship and warmth moments versus transactional ones. Background is whenever we can talk about humanizing healthcare with frontliners, they come up with their own experience and quote barriers like suboptimal staffing, too much documentation, and burnout. And so he's wondering, how do you navigate those and get them engaged in kind of something that's more relational versus transactional? They get so many administrative responsibilities.
Yeah, yeah. And control what you can control, right? So, I've had to go into some tough meetings sometimes where people are going to come at me barking, saying, you don't know about our staffing or the pay or this or this. And they want to start, if you fix that, then we can deliver a better patient experience. And I will say, I can't fix that today. That's not why I'm here today. But what I am here today is to help your patients and you feel like you can deliver a positive patient experience through the relationship piece, through growing that partnership with your patients and each other. So let's pause. And I use a lot of storytelling and try to bring it back to think of a time when you were a patient or your loved one was a patient, especially for those clinician caregivers, and the power of touch and the power of healing that happened in those brief encounters where you felt heard, you felt you could trust. All those, so a lot of storytelling, a lot of slowing it down and talking about what we can control in that meeting. Yeah.
Yeah, that's what we found with stories as well, is we
Yeah.
can try to make a rational argument to someone, but if you can tell them a story that touches their heart, that
Yes.
just bypasses everything else and lands in a different way.
You got it, Chris.
Another question from Kareem Ombani. What are the 3 top measures one can take to ensure a beautiful and successful marriage of complex systems and humans working in those systems? And secondly, any good solutions for staff burnout? So the first one was about kind of how do we coordinate systems and humans, and then the second part about staff burnout.
Yeah. So when I look at how do we measure that, when I'm looking at the first, I'm always looking at retention and I'm looking at recruitment and retention. And if I had a fabulous CNO once I partnered with, and she had this scorecard. And when she would meet with her nurse leaders, she would have on it, of course, the budget, of course, her HCAPS. This was in the old days when everybody was only looking at HCAPS. People are looking at a lot more now. But she was looking, retention was a big thing, and she was looking at turnover. And if she would see a high turnover rate, that usually led to a bigger question of what's going on. Is there burnout? Is there fatigue? What can we do differently? What can we do for that nurse leader? Because chances are, if the staff are feeling it, it's that shadow of the leader, right? So is that leader then exhibiting some of that stress that's then trickling down to her people? And so what do we need to do to help empower her and grow her and heal her heart so she can be a better leader?
And that addresses, I guess, both the coordination of people and the staff burnout, doesn't it?
Yeah.
Excellent. Well, we've got one final question for you, and that is, do you have a favorite quote you can share? And if so, what is it and why?
I love that Gandhi quote about the best way to find yourself is to lose yourself in the service of others. I think that has stuck through with me throughout my career. Yeah.
Well, thank you. That's worth sharing. That's definitely one worth sharing, and wise words. So, Amy, I can't thank you enough for your time and unique perspective today. I've no doubt our listeners are taking away lots of actionable ideas and insights they can apply in their work. To our listeners, thank you for tuning in as well. We hope you have found this as informative and inspiring as we have. And we invite you to join us for our next Humanizing Healthcare discussion. We'll be speaking to Jennifer Barron, the Chief Experience Officer for NRC Health. It's definitely one you don't want to miss. Thanks very much, everyone.
Take care. Thanks, Chris. Appreciate you.
You as well.